How you doing, everybody? Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday evening. Hope you guys had a great day. I'm just finishing up at the office. Mondays are long days for me. I wanted to jump on with you part 4, talking about diabetes, type 2 diabetes. The reason why we're talking about type 2 diabetes is many people really hurt their health when it comes to the holidays between October 31st all the way through about January 15th. My experience has been this is when we kind of shut off anything that we're doing with our health and just celebrate. And we're not really celebrating family. We're not celebrating the birth of Jesus as much as we just give it an excuse to start celebrating ourselves and just to let loose when it comes to our health. I want you to think about it, guys. 3 months that you could potentially spend doing a detriment to your health and then spending the 9 months after that just trying to make up for it. So many of you watching, you may not have type 2 diabetes, but I will tell you that a lot of you might have what's known as insulin resistance or pre-diabetes, which just means it's a matter of time, not if, but when you're diagnosed at the end stage of something, which is type 2 diabetes. So I probably should name this like insulin resistance and your exercise. But even if you do have issues with weight loss resistance, insulin resistance, things that are actually will show up on lab work before your doctor diagnoses you with type 2 diabetes, this is going to be absolutely for you, because we're going to talk about exercise, type 2 diabetes, insulin resistance from a lot different perspective. And if you've been joining us the last few weeks, I've talked about a lot of different things. I've talked about how type 2 diabetes is actually a way that your body adapts to help you survive and to help you live longer. Otherwise, basically your cells would die early if you didn't develop insulin resistance, but there's a long-term consequence with it. Talked about if your diabetes medication is even working. We showed you the research on why it really isn't working. We talked about Gymnema, the sugar destroyer, which is just one tool of many that you can do in order to help you with your sugar issues, to help you with blood sugar control, to help you with maybe overcoming cravings and things like that. And then we talked about really what to focus on when it comes to your nutrition, when it comes to type 2 diabetes. How actually having a non-inflammatory diet, yes, is even more important than insulin, okay? Today I'm going to talk to you about type 2 diabetes and your exercise and why you probably are doing it wrong, okay? And I'm going to talk to you guys about exercise from a lot different perspective, especially when it comes to blood sugar control. Now, I'm going to say something that this is probably going to help what I go over with you guys. It's going to help and be pertinent for probably about 80% of you. Now, for the 20% of you, I might, if I looked at your blood work or if I looked at your labs, I might even tell you, yeah, you're having some blood sugar issues, but I don't want you to exercise right now. I'll give you a perfect example. So we had a woman as a new patient who came in. Literally, my heart broke for her because she has literally suffered so much over the last 3 to 4 years. And I don't want to go into way too much of her history, but let's just say the levels of inflammation that she has, I haven't seen to that level. I've seen some pretty incredible levels of inflammation, but in this case, I really haven't seen it that bad. And all I had to do was actually look at her just regular blood panel and see massive amount of eosinophil concentration, high neutrophils, which means that there's just something really bad that's happening inside her body. Multiple food allergies, multiple IgE food allergies. We haven't even tested the IgGs, but I mean literally everything that she touches inflames her. But I also looked at the doctors and looking at her blood sugar levels, and her blood sugar levels are well over 100, which means that she's a type 2 diabetic. And they want to do all of these different things and probably put her on diabetes medication, but take one look and there's no... The reason why she's a type 2 diabetic has nothing to do with her sugar. The reason why she has poor blood sugar control is because her immune system is on fire and she's having a massive stress response literally all the time. And so you can actually lose blood sugar control just by having too many inflammatory stressors. So I actually told her today, she says, I like working out. And I looked at her just, took one look at her and said, please stop working out, okay? You don't need another stressor. You don't need to tear down your tissues when you're already inflamed. In fact, the only thing that it's doing is making it worse. You're stressing your body out too much. You're going to hurt your hormones. You're going to hurt your thyroid. You're going to hurt everything if you continue to work out. So there are instances where I tell people, hey guys, please don't work out. There are people who I have told at our gym, so I own a gym, hey, you need to take a break from working out because working out more is only adding to the stressor and it's too much. Your bucket is full and stressing and working out is stressing it even more and it's making you worse. But the other 80% are getting into type 2 diabetes. It's not because of necessarily just an inflammatory stress response as much as it's just I'm not actually moving enough and I'm just sitting on my butt watching too much television and eating too much doggone sugar. So for the 80% of you, this is going to help. This is not advice that necessarily is going to be for every single person clear across the board. Now, at some point it might, but some people just need to start fixing some things. Now, here's the thing with exercise is I look at exercise from a lot different perspective. I love exercise. You know, we led the mandate hashtag hashtag mandate burpee challenge coming up for the month of November. And I have a big background in exercise. In fact, that's one of the first things that I got my degree in was as actually sports medicine, exercise physiology. So yes, we took a lot of college courses on it, but a lot of it has to do with clinical experience of literally writing over 1,000 workouts and, you know, taking thousands of athletes through different kind of workouts. And I quickly discovered who was doing really well with them and who wasn't doing so well with them, who was getting overburdened and who was getting, you know, just the right amount. A lot of it was just had to do with all the other stressors that they had in their life. So you can tolerate this type of exercise, but if you also have some other issues that are going on, you're gonna have a hard time with it. So when people think, you know, hey, I'm having some issues with blood sugar control, they go to their doctor and they run run just their glucose, which is literally just, it's almost the last line of defense against your blood sugar. Once you start losing actual glucose control, then you are really having some issues because your body will hide it if you're not testing properly with things like insulin levels, you know, is probably the best, I would say, and then A1C, and then finally your blood sugar. But let's say you go to the doctor and, you know, your blood sugar is at 110, 115, 120. The doctor is going to say, well, you need to eat better. You shouldn't be eating so much sugar and, you know, maybe eat more whole grains and, and then start exercising. So the first thing that the average American or even Canadian, if you're on, you know, watching right now, they may think that they need to do is to go out and do a type of exercise like this. Like, let's go ahead and let's get on the treadmill. Let's start walking. Let's start doing the elliptical. Let's start doing a stair climber. Let's do what's known as moderate intensity, steady state exercise for 30 minutes or for 40 minutes or for 50 or for 60 minutes. And let's just keep it at a moderate pace. That's actually, guys, one of the worst things that you can do, all right? And I'm going to show you actually why, and I'm going to show you what you should be doing different. So this right here is we say, you know, I guess you could do this, but you're not doing it at the right intensity that can influence what's known as glucose sensitivity and really insulin sensitivity as well, okay? So I'm going to show you guys some pretty interesting articles that come from PubMed. Yes, I pulled this off of the internet, but this comes from PubMed, which is the database of the National Institute of Health, and they literally collect every single peer-reviewed data out there, whether it comes from the United States or whether it comes from Europe, and in fact, a lot of these are actually coming from Europe. United States, when it comes to health, when it comes to their outlook on what they're recommending as far as the government's recommending when it comes to nutrition, what they're recommending in medical schools, chiropractic schools, these things are about 15 to 20 years behind, okay? I remember I took nutrition when I was in undergraduate, and the nutritionist or the professor was a dietitian, and she wildly touted hormone replacement therapy for women, if you can imagine that. She said it was a wonderful scientific advancement, and meanwhile, she didn't realize how many cases of breast cancer it caused. So that was the premier, about 22 years ago, that was the premier advice. And now we're realizing, whoops, look at the amount of hormone-based cancers that we have caused in women. Hormone replacement therapy, birth control, these things are no good, they are bad, and they cause a lot of long-term harm. So the first one that I want to show you is this article, and it is actually done in China, okay? And here's what it's called. The effect of high-intensity interval training on physical parameters, metabolomic indexes, and serum phycolin-3 levels in patients with prediabetes and in type 2 diabetes, okay? So here was the objective. The objective was to compare the effect of high-intensity training and moderate intensity continuous training on blood pressure, on glucose control, on your lipid profile, which is like your triglycerides, and your serum phycolin level, 3 level in patients with prediabetes and type 2 diabetes. Okay? Now here's what they did. Number one, they took one group and they had them do 12 one-minute bouts of 90% maximal aerobic capacity with 1 minute of recovery. So 24 minutes of exercise with 12 minutes of active, basically all-out movement. And this can be really any movement. This could be on what we have at our gym, an Echo Bike, on a Concept 2 rower. This could be running. This could be box jumps. This could be some kind of activity that's 90% of your perceived effort. Then they took the second group and they did 20 minutes, which is what you do at your standard gym, at 65% maximal aerobic capacity. So this is just, I can basically carry a conversation with you, and I'm just going to do this steady state exercise for about 20 minutes. Now, here is what they found. High intensity interval training could help patients with prediabetes or diabetes acquire better effects of treatment in regard to anthropometry, which is basically their different body measurements, blood pressure, and glucose control. They found that high-intensity interval training and moderate-intensity continuous training were beneficial exercise strategies for health in patients with type 2 diabetes and prediabetes. However, high-intensity interval training is a more efficient, time-efficient strategy and could lower the serum level of phycolin-3 in patients after just 3 weeks of training. Can you believe that? Just 3 weeks. They already saw a difference. So what they found is we saw actually better results across the board when it came to an exercise that was done at a higher intensity. It also took less time, okay? Now, here's another one. The effects of high-intensity interval training versus moderate-intensity continuous training on epicardial fat thickness and endothelial function in hypertensive metabolic syndrome. What does that mean? That means prediabetes with high blood pressure. What was happening with the vascular system, okay? Now, guys, I'm going to show you a really interesting test result post about 3 months after the second you-know-what in this same patient. I'm working on it right now. I'll probably do it maybe on Saturday or next Monday. But what's interesting is there's certain markers called homocysteine that absolutely, when they're elevated, will tear the endothelial lining apart, and it's one of the highest indicators of heart attack and stroke risk, okay? So here's what they found. In the high-intensity interval training group, participants performed for 3 minutes at 40% heart rate, and then they alternated with 3 minutes at 80% of their maximal heart rate, where participants in the moderate intensity control group performed at 60% of their heart rate 3 times a week for 8 weeks. The results is what they found is that high intensity interval training could be more effective than moderate effective continuous training in improving endothelial function in patients with hypertensive metabolic syndrome. So you have high blood pressure. How many times, rather than throwing a blood pressure pill at people, do they say, well, maybe you should go to the gym and do high intensity interval type training instead of just walking for 20 or 25 minutes and still be able to carry on a conversation? Now, doctors should be recommending that. Now the next step is you say, hey, doctor, can you show me what I'm supposed to do? And chances are they're going to say, nope, I have no idea, because I will say 95% of them, including even in a lot of natural health, can't tell you what to do because they're not doing it either, okay? So when you look at this, in fact, we have gotten people off of blood pressure medication. Why do they go off of blood pressure medication? Because when we start improving their lifestyle, if they stayed on a blood pressure medication, it would lower their blood pressure down to dangerously low levels. Remember, blood pressure medication doesn't work with the body, it manipulates the body regardless if you need it or not. So sometimes people will be like, wow, I'm waking up now and my blood pressure is 85/50. I'm like, you better talk to your doctor and get them off of that medication because it's now becoming too low and it means you don't need to be on that medication. So high intensity exercise on high blood pressure, okay? High intensity interval training is associated with a greater impact on physical fitness, insulin sensitivity, and muscle mitochondrial content in males with overweight, obesity, as opposed to continuous endurance training. So here's what they found. They took males considered overweight, obese, and who is this? 42 to 57 years of age. I would probably say that about 90% of males in the United States age 42 to 57 are either overweight or considered obese. And then they took these two groups and they had them do high intensity training and then moderate intensity continuous training, okay? So here's what they showed. High intensity training showed a significant increase for insulin sensitivity. That was one of the biggest things that they found. High intensity training elicits a stronger beneficial effects on physical fitness, insulin sensitivity, and muscle mitochondrial content as compared to continuous aerobic training. So what are those mitochondria within the muscle? These are the powerhouses. These are the ones that are producing energy. When you're doing high intensity exercise, what you're doing is you're demanding more blood, more oxygen, which requires the muscle cells to make more powerhouses or more engine in order to drive that metabolic process up. And so it's kind of like saying when you're doing high intensity exercise, you're creating a need for those muscles to require more energy. That's pretty cool because when it comes to your muscle mass, when it comes to your muscles, you don't want them to be super efficient with energy. You don't want it to be like a 4-cylinder car. You want it to be like an 8-cylinder gas guzzler. That requires more energy input into those muscles. So I think I have one more. The effect on glycemic control for low volume, high intensity interval training versus endurance training in individuals with type 2 diabetes. So basically what they're saying is what's the effect on doing a very low amount of high intensity exercise with people who have type 2 diabetes versus doing endurance training or doing long duration type exercise. So here's what they did. A total of 29 individuals with type 2 diabetes were allocated to control, okay? Either the endurance training or the high intensity interval training groups. Training groups received 3 sessions per week consisting of either 40 minutes of cycling at 50% peak workload or 10 1-minute intervals at 95% of peak workload interspersed with 1 minute of active recovery. So 20 minutes total. Basically what they say is go to work as hard as you can for 1 minute. Then we want you to actively recover for the next minute. We're going to do that 20 total minutes, but 10 minutes of actual work. And here's what they found. High intensity interval training decreased whole body and android fat mass compared with the control group. In addition, visceral fat mass, hemoglobin A1C, which is your 90-day blood sugar average, fasting glucose, glucose after eating, glycemic variability, and insulin resistance numbers decrease after high intensity exercise, okay? So here's what they found. This is what's interesting, is despite a 45% lower training volume in these people who did high intensity interval training, HIIT resulted in similar or even better improvements in physical fitness, body composition, and glycemic or sugar control compared to the endurance training group. HIIT, high intensity interval training, appears to be an important time-efficient treatment for individuals with type 2 diabetes. So guys, you could look at this and there's hundreds and hundreds of articles. I think I just gave you 5, but the end result is this. High intensity interval type training is superior for blood sugar control. It's superior for losing fat mass. It's superior for making your muscles basically a metabolic machine that requires more energy, and it actually is way less time efficient. This is why when people say, I don't have time to exercise, I say BS, okay? I tend to be very honest when people are feeding me a line, and because I would appreciate if they were honest with me if I was giving a silly excuse. Guys, we all have 20 minutes a day. We really do. Just peruse, your schedule and see where you are wasting hours upon hours when you could be doing things like high intensity interval training that's just going to take you anywhere. Literally, it could be as little as 4 minutes up to 10 to 12 minute intervals tops. Okay, so let me talk about this, Dr. Nate. So we just showed you some articles, and yes, this is showing about the superior benefits of doing some kind of high intensity, short duration type of exercise. Now, what on earth should you be doing? How do you fashion this? Okay, this is one of the reasons why we have a gym, is because we literally rebuild people. Not only do we do high intensity functional training, but we're teaching people how to become athletes again. We're teaching them how to run. We're teaching them how to be able to jump. We're teaching them how to squat again, how to pull, how to deadlift. We're teaching them things that they need to be able to do as they get older and as they age. So if you're going to do it, have a crossover effect when it comes to exercise. So what should it be? It should be intense. A lot of people don't like to do it because it requires a little bit of mental fortitude and a little bit of mental toughness. I will tell you, when I first started 11 years ago, I was the biggest wimp out there. I avoided it because, yes, it was uncomfortable. But the more I did it, the more my body wanted it. The more I did it, the tougher my mind became. And in fact, this actually crossed over not just with exercise, but in every single area of my life. So yes, it should be intense. Yes, it should be short. And yes, if you're going to get the best bang for your buck, it should be functional. Now, what do you mean, Dr. Nate, about functional? Meaning this should mimic things that you need in everyday life. So this is why almost the movements that we're primarily doing at the gym are requiring things like running. It might be a specific type of biking called echo bike, might be a Concept 2 rower. It might involve a jump rope. It might involve pulling things off of the ground, like a deadlift, like a clean, like a snatch, using barbells, using dumbbells. It might be pull-ups. It might be a variation of a pull-up. It might be pressing things over your head. There's an infinite number of things that you can do in order to keep things functional, but at the end of the day, it shouldn't just improve your glucose sensitivity. It shouldn't help you to lose weight. What it should do is be able to do all of that, plus make you just better at your everyday life. Because at the end of the day, you don't want perfect blood sugar, yet you still don't know how to throw or pick something up, or you still can't play with your kids. So that's why intense, it should be short, and it should be functional. And in fact, it really shouldn't take that much of your day, and you should be doing it, for a lot of people, we start them out at 3 to 4 times per week. Now, for me, doing it so long, I've gotten into the point where I've exercised way too much. I got very chronically inflamed, started to develop a lot of issues with recovery, and so I've actually have in the past scaled things back quite a bit. So as far as how often I'm elevating my heart rate, I don't need to do it as often as I used to, because this is coming from someone who is pre-diabetic and flunked his life insurance test about 12 years ago. So I'll do it, at least getting my heart rate elevated, at least 3 times a week, sometimes 4, even sometimes 5. A lot of it just depends on the week, and a lot of it will depend on my schedule, but my minimum standard of engagement is always at least 3 to 4 times per week, no matter how busy I am, okay? Now, if you guys need some ideas, I don't know if you guys know this because I never promote it, so here's a shameless plug. So this inspired me so much that about 3 years ago, I wrote a book, and it was called Transformation 28. And so there's a great chapter, I believe it's chapter 7 within the book, that specifically talks about exercise in a lot more detail than what I just went over tonight. And the thing about the book, why I don't promote it all too much, is because I'm not 100% happy with the book. There are certain things, even when I released the book, saying, you know what, I wish I would have changed that. I've changed my opinion on it, but I would say probably 80% of the advice within that book is pretty good, okay? And you guys, if you guys know this, you can buy this on Amazon. So you can buy it on Amazon and it'll get shipped to you within a couple of days or so. And the cool thing is we even have it on audiobook as well. So you can even go on Amazon, what's known as Audible, and you can even just buy it and listen to it in your car. So we do talk a lot about exercise, and we talk about the role of sugar. And in fact, but the biggest beef that I have, yes, with my own book, is that I don't go enough into people who are sick who think that this is going to be the answer. So this can be a great answer once you recover from certain things. And a lot of people who are starting off, who are coming to see me, don't necessarily need to be doing this. But if you guys have been working on your health and you need a better understanding of how I look at exercise and how I look at training from a different perspective, then you guys will find a lot of value if you guys go ahead and get that book. So you can get this on Amazon and it will get shipped directly to you, or you can even go on Audible and then actually can get the audiobook too. So you can listen to me just drone on for an hour or so reading the book, all right? Now I'm going to show you guys that how this works in real life, okay? We have, hundreds of examples of this working. In fact, I just went over a woman's test results, today. So about 5 months, and we retested. She's got her triglycerides went from about 150 down to 70. Her blood sugar went from about A1C 5.7 down to 5.2, insulin to 10 down to 3. Her leptin levels, which is basically her hunger hormone and involved with fat burning and hunger and things like that, went from 34 down to 10, which means she's less leptin resistant. And she's also has lost about 30 pounds. At this point, I told her, I said, listen, your body is recovering. Let's hit the gym, okay? So now we got her a membership to go to our gym. I actually gave it to her, and I want her to try doing some high intensity type exercise, not only just to help her start moving better, but to help her build some muscle that's going to help her become a little bit more lenient, when it comes to her ability to be able to process sugars. But I'm going to give you an example, okay? This is things we see all the time. Gentleman came in, C-reactive protein, very high cardiac risk right here, 3.15. Testosterone levels at 171, guys. If your testosterone is at 171, you are not a husband. You are a great roommate to your wife, if you know what I mean. And then his hemoglobin A1C, 5.9, puts him into pre-diabetes, very close to losing complete blood sugar control. Now, this was after 5 months. CRP down to 1.2, testosterone up to 417, and then his A1C down to 5.2. So in 5 months, no longer pre-diabetic, testosterone went up about 250%, and then this dropped by a factor of about 2. By the way, we didn't give him anything for his testosterone because he has 2 you-know-what, which means he should be able to produce testosterone the way it's supposed to. No testosterone therapy, no exogenous testosterone, nothing like that. A lot of it tied around him getting his blood sugar under control. And yes, one of the things that we utilize for him as a tool is getting him to the gym and starting to do high intensity functional training. I'm going to tell you guys something. We have so many people who call our office and they want help, but they quickly are turned away, not by me, but by the fact that they know that they're going to have to pay for testing, and they also are turned away by the fact that it's going to be 100% up to them in order to change their life. There really is no magical herb, no magical pill, no magical supplement that's going to take them to total health freedom. The other things that we do are a tool until we start to see that the labs are starting to stabilize. And you know what we do? We take them off of those things because I believe that no one should have to be on the same supplement for the rest of their life, okay? Now, not everybody should necessarily be doing this form of exercise, and I'm going to give you an example. I got this message a little while back on Instagram, okay? And I get a lot of messages, Facebook, Instagram, Twitter, and if you've sent those messages, I guarantee you I probably read it, but I cannot respond to everybody, so I apologize. But here's what she said. She said, "Hi there, I'm all about the anti-inflammatory lifestyle," which sounds good, preventing cancer, diabetes, heart disease, and Alzheimer's. Though I lost, now watch, 50 pounds, and I healed my gut. Okay, I got up to 40 minutes of high intensity training on a treadmill. This is where I thought, this is probably going to go sideways pretty quickly. 40 minutes of high intensity training on a treadmill every single day. Here's what happened. I am now at my all-time worst, in pain, and I can't sleep, and all I want to do is drink whiskey and I want to smoke. I have been caring for my sick mom who lost her husband, had to move out of her foreclosed home, 4 kids left here, 3 out of the house, and when you looked up stress in the dictionary, you see me. And so you see that she has quickly exercised herself and stressed herself into her worst health ever, again. So, I want you to think about it. One of the things that ladies do a lot is they exercise themselves into poor health. Is that possible? Yes, it 100% is possible. Because remember this, guys, ladies, if you're over-exercising, you are going to wreck your progesterone levels. Let me say that again. If you're over-exercising, you're going to wreck your estrogen or your progesterone levels, and you're going to have a really, really bad day. And the reason why is when a woman gets stressed, she needs cortisol in order to handle those stressors. And then if she starts adding too much high-intensity exercise, their body will rob the pregnenolone to make progesterone and use it in order to make cortisol. Okay, it's called the pregnenolone steal. And this is why it's very hard for men to over-exercise. Yes, they can, but it is so easy for women to over-exercise. And that's why we talk about training around a woman's menstrual cycle. There's times to go all out. There's times to scale it back. And this is why I've also told women, hey, stop exercising, because their body is too stressed, and adding a higher cortisol push is only going to stress the body out even more. And this is why women will come to me and they'll say, I need to lose weight. I can't. I've tried exercising more and eating less, and I've only gotten worse. And this is why you got to understand, your doctor has to understand the role of exercise, the role of the stress response, the role of inflammation, and know when to say, hey, you know what? You need to take a break, and we need to handle these inflammatory triggers. We need to take out these things out of your stress bucket, and we can add them back in when you start taking care and you start handling other things. So hopefully, guys, that makes sense when it comes to exercise. Is there a stress component to type 2 diabetes? Absolutely. And so high stress will cause elevation of chronic blood sugars, as well. And so, yes, there is a nutritional component. Yes, there's a mental stress component. And yes, there's a chemical inflammatory component to it. And you need to be handling all 3 of those. So guys, I'm going to give you a little bit of a preview of what's coming up on my next live. And this is actually, we're looking at the blood work of our person that we did our initial video that went viral, that was not intended to go viral. But this is going to show you something, and here's the preview, is if you look at this marker, this is called homocysteine, okay? It's an inflammatory marker that's involved in detox. It's involved in the production of things like adrenaline. It's involved in your vascular system. It's involved in high blood pressure or normal blood pressure. It's involved in detoxification. I think I said it. It's involved in literally almost every single body process, and the process is called methylation. It's not a special process, but when methylation is driven down, particularly in the liver, you're going to have a really, really bad day. And I want you to think of all the symptoms that are associated with fibromyalgia. So this individual, when we measured his homocysteine based on his symptoms post-second you-know-what, we saw one of the highest homocysteine levels that I have seen. It's the second highest that I've actually seen. The first highest was over 50. They stopped measuring it. But at 30, you're going to feel like absolute garbage. No energy, lots of inflammation, poor recovery, and you name it, it's what's going on right now. So the question is are there people experiencing changes with methylation that's occurring primarily at the liver post-second you-know-what? We're going to ask that question. I'm going to show you what methylation is, and I'll also show you what we're doing in order to help this individual, okay? So we'll be doing that either Saturday maybe, or maybe next Monday. but please make sure that you share that. Make sure that you tune into that as well. So guys, I hope you guys learned a lot. I hope you guys are inspired. I hope you guys get a little bit of better understanding of how to start thinking differently when it comes to type 2 diabetes. And we'll check in with you guys a little bit later on in the week. And I hope you guys have a great rest of your night. Guys, as always, I always appreciate when you share these videos and you share it with other people. Make sure that you share. The more that we can get great content, great information out to people and start helping people take their health into their own hands and start taking responsibility, the more that we will be a healthier, the more that we'll be a happier country. I can guarantee you that. And that's what my mission is for you guys. So guys, be well and have a great night, and we'll talk to you soon.